Enough already with the name-blame game. Not again. Screamers, the right-wingers. Enough already with the name-blame game. He said, she said, the left did, the right didn't, or the right did and the left didn't. Conservatives what? Oh no, talk radio. The bloggers, the liberals, interruptions at the town hall meetings, nothing but racists, GOP, the Democrats. I can go on and on and on and on. Enough already. Scenario 1. Rob has a fall in his garage while fixing his motorcycle. He calls his wife, who takes him to his doctor's urgent care. He has x-rays. He is told that he has broken his wrist. He has to have surgery. He could have the surgery on Wednesday, but chooses to have it the following Friday because it fits better in his schedule. After the surgery, he will wear a brace and go through physical therapy. His biggest complaint is not being able to use his right hand and play with his toys. Scenario 2. Nona. Nona is talking to her sister on a sunny Sunday afternoon. Her sister is complaining about her back hurting. She told Nona that she got up in the morning and called her doctor's office or exchange and got the nurse and set up an appointment for Monday morning. Nona was absolutely shocked. She said, "You called on a Sunday and got an appointment for tomorrow, Monday morning?" Her sister said, "Yeah." She said, "I have a PPO. I can do that." And then she also said that a lot of the HMOs had been calling her trying to get her to sign up for their program. And she said that she told them absolutely not. She loves her PPO. She has a great PPO and she has wonderful doctors. And she said her doctor got out of the HMOs because they were always trying to tell him what he could do and could not do. And he had had enough. And Nona was just totally shocked because she said a lot of times, even if she wanted to make an appointment, it might be 2-3 weeks, and then sometimes it could be 3-4 months. She was just blown away by that. Scenario 3. Laura, independent contractor, inherited her home in which she lives in from her parents. Has an ad in the local newspaper to rent out 2 of her 3 bedrooms. Although she makes good money as an independent contractor, she has existing medical issues where her medical insurance is so important and valuable. So far, she hasn't found her roommates. Scenario 4. Lena. Lena was waiting for her sister to pick her up from her appointment. Her sister calls to let her know she's on her way. A guy overhears their conversation. They start talking. He tells her that he had just had surgery on his back. So Lena asks him how he was doing. The guy says much better. The guy lifts up his shirt and shows her his incisions front and back. He says he's a recovering drug addict and that when he was high, the pain in his back didn't bother him, but when he got sober, the pain was unbearable. He said he was doped up with morphine as a painkiller. So Lena says that she was working on a project about health care and that did he mind answering a few questions. He said nope. So she asked him how was the surgery paid for. Was it ORSA? Lena asked. The guy says ORSA doesn't pay for inpatient stays. So Lena says then it must have been ATP ability to pay. The guy says yes. He also said he did have ORSA and that it took approximately 1 year to get the surgery approved. Lena's sister showed up as well as the guy's ride. Hey Congress, you were elected and re-elected. in your county and state by the American people to represent work for the American people. Nona's opinion. Every American can have access to health care, no doubt. It is the quality of health care. There's HMOs, PPOs, there's the county, city clinics, hospitals, specialty clinics at the hospitals, Medicare, Medicaid, emergency rooms, doctors, nurses, residents, interns. People even pay cash, believe it or not. And there's people that don't obviously have to pay anything. I've seen it, and I have friends that have the best health care known to man/woman, child, cat, and dogs. And I know people that don't have any health care at all. That's on paper, but they do get health care. And then I also go to places where I see a lot of immigrants getting health care, and they don't even speak the language. They even fill out the paperwork in their own language. So I believe it's just the quality of health care you get. Specialty clinics at the hospital for tests are open on certain days and times. The appointments that you get for these tests, sometimes your appointments could be a 3-month wait. If you miss the appointment, oops, you may not be able to get it until 3 months later. And sometimes they might even penalize you for it and say you can't have that test because you missed the appointment. So I believe that what needs to be done is fix the cracks in the healthcare system. And I think most of those cracks are in the county, state level. Because the people that don't have the health care are using the clinics in their state, and that's where the problem lies. And then you have the Medicare, and you have Medicare D for prescriptions. I think that needs to be looked at because a lot of people that are on Medicare, a lot of them have the supplement, which helps them with the Medicare, especially if they don't have an HMO. And even if they have the Medicare D, which is for the prescriptions, a lot of times they cannot afford that medication. And with the help of Walmart, with the $4 prescription plan, and that's pretty cool. That's good. But if they don't have that or can't use that for some medications, it is amazingly high for what they have to pay. And a lot of times it does them no good, especially if they don't take their prescribed medications as they should, cutting their medications in half or stockpiling them to try to make them last for the month and skipping the medications. It's not doing them a world of good to get healthy or stay healthy. And then there's the dental portion. Even people that have good medical care, HMOs or whatever, a lot of times they have to pay a big portion of their dental. So I think if anything needs to be looked at, it is the Medicare B for prescriptions in general, and also dental, and then the clinics in any town, USA. I think those are the main things that needs to be looked at. And let's call it a day. Thank you. Nona, signing off.